Welcome to You and Your Pets. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital, and we discuss a broad number of issues on pet care and questions you probably should be asking your veterinarian. Tonight we have a special guest, and I would like you, Dr. Rogers, to introduce him, if you would, please.
Thank you very much. I'd like to reintroduce Dr. Jonathan Goodwin of the Garden State Veterinary Specialist Clinic down in Tinton Falls in Island. Dr. Goodwin is a cardiologist, and I'd like to consider him a friend and an excellent colleague, and he always helps me out. He went to my alma mater, Tuskegee University, and we both graduated from there a couple of years apart, more, just two, or six. And Dr. Goodwin is now here to discuss an issue that I find very pressing in my clinic, and that is heartworm disease. And we're going to be discussing heartworm disease in our pets, and that's a topic for tonight.
Okay, what is heartworm disease?
Heartworm disease is actually a type of parasite that's passed to the dog through the mosquito that results in worms that will actually live in your pulmonary arteries. These are the arteries that carry blood from the right side of the heart into the lungs.
Okay, now, is this the same kind of worm that we look for in a dog's feces?
This is not one that we would see eggs or worms in the feces, but it is another type of worm that's very, very prevalent and very, very dangerous to dogs.
Okay, how is heartworm disease spread?
Heartworm disease is spread by a mosquito biting a dog that already has the heartworms. The dogs that have the heartworms, the worms get together and produce baby worms called microfilaria. These microfilaria get taken up by the mosquito when the mosquito is actually taking a blood meal. And when this occurs, those microfilaria start to grow up in the mosquito. After spending a little bit of time in a mosquito, when that mosquito goes and bites another dog, it can implant those more mature baby heartworms into that dog, infecting it. And then within the next 3 months, you have full-grown heartworms present in that dog.
For heaven's sakes. Is it worse in some seasons than others?
We tend to see it be worse the more mosquitoes there are. So we see more mosquitoes in the warmer times of the year, definitely the warmer, moister climates. But you can get heartworms anytime there is a mosquito that has taken a blood meal that's carrying baby worms in it.
Are there some areas of the United States that are more heartworm prone than others?
Yes, very much so. The areas that are actually the warmest tend to allow for mosquitoes to breed the most. Also the areas that are wet. Mosquitoes usually need water because the ones that are actually taking the blood meals are usually the female mosquitoes. So they go, they feed off the poor unsuspecting dogs, and then their return gift may be to leave a heartworm. So we see these worms very prevalent in the southeast, anywhere in the south, coming up along the whole east coast. You don't see it as much in the cooler climate areas of the U.S. like the Northwest or Alaska, but anywhere else, your dog's at risk.
So if I keep my dog in the house to prevent any type of heartworm, is that safe enough?
Unfortunately, it's not. One of the types of mosquitoes that we know is one of the most prevalent that carries heartworms is the species they actually call the house mosquito. So those are the ones that actually come and bite you in your house. And so they'll come and bite your dogs. You know, if you open a door, a mosquito can come in. If you have a screen that you just leave open and the screen is either screening your window or your door, they can come through potentially the screen holes depending on the size of the mosquito. So there's not really a safe way to protect them by shielding them from the mosquito. We have to depend on medications to protect them.
So what animals are affected by heartworm?
The dogs are the mosquito's favorite animal to feed on and carry the heartworms, but we'll see it in cats, many of the wildlife species. I know I've seen it in black bears. It's been shown in groundhogs and many species. Actually, even humans can get it, but it doesn't seem to form any real disease. They just seem to form, they tend to ball up into little spots in your lung, and they form what they call little granulomas.
And similarly, we can see it in cats as well.
True.
And it's been known most animals, mammals, are susceptible to it. And the question is, what do we have to do about things like ferrets that are in our house and other animals? But the reason why we focus on dogs is because the most critical clinical signs and the most devastating consequences are often in dogs.
Are the symptoms the same in all pets and also in wild species, or do they present themselves differently?
Most of the wild species, we don't tend to see them get very sick from the heartworms. The two species that seem to get the sickest are the dogs and the cats. Now the dogs tend to, because they're larger, tend to be able to handle a larger worm burden, and therefore, where they could have 100 worms in the dog, and it may not really bother them much. Where a cat, because their immune system is so reactive, one single worm in a cat can potentially be deadly.
And how do you know that a cat or a dog has heartworm? What should the owner be looking for?
Typically, if they're talking about clinical signs, you're not usually going to see a lot of clinical signs early on in the disease. That tends to come later. So by the time you're seeing signs, it's usually not great. As long as you're going into your veterinarian and getting a blood test done twice a year to see where you stand in terms of your heartworm status. For dogs, they do a blood test to see if you have any evidence of worms present. For cats, unfortunately, it's a little bit tougher. The blood test they use, they have two different blood tests, and one works about 31% of the time, one works about 33% of the time. So with cats, you often have to be more diligent in your search because it can be tough to find them.
So when you have a pet that has it, and I have a little slide here, two dogs, one of which is heartworm positive, the other one is heartworm negative, you really can't tell the difference early in the disease. Until they start having cardiovascular or heart symptoms, you really don't see a difference in either of the dog that's positive or negative. The one point I would like to make, and I think you would have made this, is that a dog in an environment that is heartworm positive is more likely to infect the other dogs in the local area. As Dr. Goodwin pointed out, a mosquito will feed on a heartworm positive dog and then feed on a non-positive dog and infect it. And so if your neighbor's dog is heartworm positive because it's outside all the time and he doesn't take proper care of it, your dog is more at risk because that dog could potentially be positive. And that's true if your dog goes to a kennel, if your dog goes to a boarding place, if he goes outside and runs, all this is possible. So we have to be concerned not just about dogs and cats, but whether or not they're positive or negative. And you can't tell the difference. That's why Dr. Goodwin is suggesting we do the heartworm test.
And Dr. Rogers is 100% right, because it all comes down to the mosquitoes. Mosquitoes aren't very strong flyers, so they don't go flying for miles and miles. They'll have a radius that, if you even give them, half a mile radius, they might be. So if you have an infected dog in that area, then that dog is going to make every other dog and cat in that certain radius at risk. And they do know mosquitoes can fly up to about 21 stories. So they're not super strong flyers, but 21 stories up. So even if you're in a high rise, you're not totally safe.
They fly better than I do.
One question, is there any way that a pet can get heartworm without having been bitten by a mosquito? Is that the sole method of transmission?
That's the sole method of transmission, being bitten by a mosquito.
And that's absolutely it. And so if one is really strong on controlling insects in the house, that would reduce the risk for the animal, at least to some degree, right?
It would. And the thing that's getting a little bit difficult now, and it kind of seems as though it wouldn't matter, but there's another disease going around that's a white fungus that's attacking bats. And you say, well, why would you want to bring up bats? Well, bats tend to take out about 150,000 mosquitoes a night. And what we've seen happen recently is this white fungus disease in the bats has set off and messes with their sonar. So they're not flying, they're not hunting down as many mosquitoes. Less bats eating mosquitoes means more mosquitoes even present. The other part of the story that's gotten a little bit scary is everyone remembers Katrina. And everyone remembers Hurricane Katrina's rescue efforts to get all of these dogs out of Louisiana before, during the hurricane that had lost their homes. And these dogs were taken. The numbers they estimate are just about 95,000 dogs were removed from Katrina. In that, those 95,000 dogs were sprinkled all over the United States, and it's believed that potentially 85 to 90% of them could have had heartworm disease. So that means now you've added in dogs that act as a nidus for the mosquitoes to bite and carry the disease, even in areas where it wasn't typically seen. So you might live in Colorado where it's cold and there are not very many mosquitoes, but you have a few, and now if you have a dog there that's heartworm positive and your dog's not on prevention, your dog is now subsequently at risk for heartworm disease.
Although we do recommend in most cases, at least I do to my clients, that we use something like a Vectra 3D, which is a parasitological or a parasite preventing chemical that we actually put on the back of the dog, and that prevents against fleas, ticks, and mosquitoes. So people who use Frontline or other parasitologicals or parasite preventing chemicals that don't hinder mosquitoes tend to be more at risk than those who use something like the Vectra 3D. Similarly, we also use pills and a lot of them are ivermectin based, and there are some that are based on other chemicals that will be able to be used in these animals. So we actually have a two-prong attack for protecting our animals.
So you just named the preventatives that can be used. Could you name those once again for the audience? Because they sounded like rather complex, long names.
Okay. I think realistically, we have several different types of parasitologicals is just a big, long medical term for chemicals that prevent parasites. But what I'm talking about in this case is Vectra, which is a chemical we put on the dog to prevent fleas, ticks, and mosquitoes. But there are other ones that also prevent fleas and ticks.
That's the brand name, Vectra.
That's the brand name.
Right, and can anyone get Vectra, or is that
You
only
have to get it through a veterinarian.
You have to get that through a veterinarian.
And then
Okay.
the pills that we use to prevent heartworm in a dog that actually kills the disease in the tissue is called ivermectin.
And that also is only
That's
available from a
Also
veterinarian?
only available through a veterinarian by prescription, in fact.
Okay.
And there are other ones similar to that that would allow us to use chemicals to prevent that in animals that are sensitive to ivermectin. So we have other drugs that we can use for animals that are sensitive to ivermectin.
Okay, you mentioned that an animal doesn't present symptoms until much later on. What are some of those symptoms in just the few seconds that we have before the break?
Sure. In terms of symptomology, you'll often get cough. Cough is a big one.
Cough.
In dogs or cats, they both will do that. Sometimes you'll see less energy towards exercising. We talk about it as being exercise intolerance. They just can't quite keep going. But cough is one of the big signs that you'll often get with these guys. It can progress to get so severe that they can actually develop right-sided heart failure, where they'll develop a big belly full of fluid, where they look like they're pregnant.
Okay, well, we have to take a break, and we'll be right back. This is You and Your Pet. I'm Jim Horton, and we'll be here right after the break.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers, and our guest, and we will continue discussing heartworm disease. Dr. Rogers, would you take over?
Thank you. Thank you. I think we have to discuss the clinical side of heartworm disease,
Sure.
which is what you do primarily.
Correct.
We understand that the information side of how we prevent it, how we recognize it, is important. but I would like you to give us some further indication. We talked just before the break about how the diseases progress.
Right.
And so initially we can have a mosquito biting an animal, the parasites or the microfilaria, I guess they're microfilaria, go into the skin.
The microfilaria will go into the mosquito, and then they grow up and they grade them in terms of life cycle, like L1, larva 1,
Right,
larva 2,
right,
larva
right.
3. And the larva 3 is what leaves the mosquito and goes
is-
back into the dog.
Goes into the dog's tissues.
Correct.
And then moves towards the vascular system or the blood system, and then enters the blood system. So what approximately is the time? What time do we have it in the tissue? I believe it to be something in the order of 3 months before, and that's where we treat them. That's where we try and kill them. So could you give us a little bit more information about after a mosquito bites an animal?
Sure. So after that bite occurs, we basically have, like you said, about a 3-month window to get these dogs onto, maybe two months, onto some type of heartworm preventative that will actually go and kill these young growing larvae before they reach adulthood, because the preventative won't kill the adults. We'd have to come with a stronger, different
Right,
drug
right.
to kill the adults.
But, pardon me for interrupting,
Yes,
but
sir.
how does someone know, unless they see a mosquito bite on their animal and recognize it as a mosquito bite, know that something has happened? It's almost impossible, isn't it?
You're absolutely correct. And that's why, like Dr. Rogers was saying, we typically depend upon preventatives, using heartworm preventatives on a monthly basis, because that doing it monthly keeps us protected, keeps our family members that have 4 legs protected. If we don't do that, then you're talking about potentially thousands of dollars to try and fix something that's 100% preventable.
Okay. Go ahead, I'm sorry.
No, that's fine. That was an excellent question. The other thing I'd like to point out, or have you point out, is as this heartworm develops, before we start having congestive heart failure, before we have exercise intolerance or the animal's inability to run and chase a ball or come to the door or whatever, what symptoms are there?
Basically, cough is the big one. Cough is the one that tends to span the species, because although we call them heartworms, they're really more pulmonary artery, or the main artery that carries blood into the lungs type worms. And these worms cause a lot of damage and irritation to those pulmonary arteries, and thereby cause irritation to the lungs. And when you see that lungs get irritated, that's why you often will get some cough that occurs.
Now, is this a consistent cough or just an occasional cough?
Sometimes it will be after exercise. So they'll call it like an exercise-induced cough. Anytime the dog does anything strenuous, you might see that. Cats, it's even a little bit more insidious, because they might cough at any time, because they don't have to do something strenuous to start seeing the signs. Mm-hmm. The times when the cats get the most sick from the heartworms is when the heartworms are either migrating through their lungs or when the heartworms start to die. The dogs tend to get the most sick when either they have a large burden of worms or they start having an allergic reaction to the worms that are present. That oftentimes leads to those main arteries going out to the lungs starting to kind of close down and constrict.
All right, so this would be a consistent, because our dog, for example, will just sneeze and will cough on occasion, but he doesn't do it regularly.
Do you have him on heartworm preventative?
And he is on heartworm preventative.
Then
Yes,
you
he
have
is.
no worries.
He is my patient. He is on heartworm preventative. We don't mess around.
There you go.
But I think one of the things that we should point out is that when a dog comes to me with a mild cough or a problem, a lot of times the owners come to me and say, you know, I come in the house, the dog used to run down and jump up and run around, and now he just comes down, looks at me, and lays down. That's a sign, very subtle sign, that we have to be concerned about. So what do we as veterinarians do to diagnose this? We have a blood test, and then we have some radiographic signs. So could you just give us a little bit of information about the blood test?
Sure. In dogs, the blood test is actually aimed at, and it seems kind of funny, but it's aimed at a special protein that only the female heartworms carry. And so the actual blood test is a test for adult female heartworms. So if you said, well, what if my dog has just 3 male heartworms? Then it won't come up positive on the test. Cats, this is one of the reasons why it's so difficult in cats, because you can do that, what they call an antigen test in cats. And if your cat only has 1 or 2 worms and they're both males, it won't come up positive. So then the second test you can do is what they call an antibody test, where it's a test to see if your body or your cat's body is actually producing antibodies to the worms. And then if we can see it there, then we say, okay, there's a sign that we were at least exposed to heartworms.
Right.
We may not still have them, they may still be there, but we were at least exposed. Some cats are actually able to fight them off and kill them on their own, but it's such a risk.
Right.
The third thing that we can often do is actually do an ultrasound of the heart called an echocardiogram. And that echocardiogram allows us to actually look into those main vessels in those main pulmonary arteries that we called, and see if we can see some worms. Also, we use x-rays very, very often to see if there are changes in shape to the way the heart normally sits, and that can give us an idea of whether or not we're dealing with heartworm disease.
And that shape that changes in the heart is what we call, and what we learned in school was an inverted D.
Right.
Or it would be what a D would look like if you were looking at it in the mirror. So if you're looking at the animal's chest, as in this x-ray. We do some ultrasounds, and the average veterinarian might not do an ultrasound, but we would refer to Dr. Goodwin or an internal medicine person who would then be doing the ultrasounds in those cases. So we have several ways of diagnosing heartworm. One, by blood, and in the dog and cat we have tests for both of those. As Dr. Goodwin pointed out, the blood test in the cat is not as reliable as the blood test in the dog. And then if we suspect that there's heartworm in the dog, if I do a blood test in my hospital and suspect there's blood test because it comes back positive, I'll then draw some more blood and send it to the lab for a confirmatory test. So don't be surprised if your veterinarian says, I'm going to have to take more blood, it looks like it's positive. Well, doc, don't you know? Well, no, one is a supportive test to the initial screening. So that's why we would do 2 blood tests. And when it comes back and we know that we think that there's an issue, we will take an x-ray of the heart. And it's not a bad idea to take an x-ray of the heart anyways, but if you take an x-ray of the heart and you see an inverted D, I might well send it to Dr. Goodwin to do an ultrasound or an echocardiography and look at this thing. So we have a number of steps, but certainly, as Dr. Goodwin pointed out, the most efficient way of preventing things, and this is why we have this series, Preventative Health, is to prevent it in the beginning by using the appropriate mosquito and tick and flea preventative, and then by using the appropriate heartworm preventative. So when we talk about these, I remember when I was a kid and a technician, we used to have surgeons that would go in, open up the heart, and pull these worms out. Mm-hmm. They no longer do that.
Well, it's funny that you should ask that, because in cats, if we see a number of worms, because we know how serious it is when those worms die, if we see a large number, and with a cat that might be 4 or 5, and they are reachable, we would try to potentially go and remove them. In a dog, if you've got a large number of worms, then you may also surgically try to go and remove some, and then come back and follow it up with the special treatment. They call it an adulticide therapy. They called imidacide, that actually works to gradually destroy all the worms that are present and just cause them to disintegrate.
And so when a worm disintegrates, it disintegrates into microscopic pieces. But what if it disintegrates into a larger piece, or falls apart when you're doing the surgical extraction, or it falls apart because the dog has been given a drug that just killed this worm?
Excellent question. I mean, one of the big things that you have to do after you give the adulticide therapy is these dogs must be strictly rested. They can't go run and play for the next month. If they go outside to use the bathroom, they need to stay on the leash. The reason why is because, as you were saying, Dr. Rogers, not all of these pieces are microscopic when the worms start to disintegrate. The bigger pieces can form blood clots that can go showering throughout the lungs and make it so you can't breathe well. They can cause all kinds of damage and issues with these guys. And the big problem that you run into when you were talking about the surgery, you don't want them to break, because when the worms start to break apart, that's when they're the most likely to release the things that irritate the body, that form these huge immune type responses. You hear about people who have serious allergies to peanuts and that they carry their EpiPen with them. These same types of reactions can occur secondary to the worms breaking apart. So if we go in surgically, you have to actually remove them very carefully to avoid breaking the worms and causing this massive reaction. This is why, one of the reasons why we can't even give the adulticide therapy to cats. If you give it to cats and the worms start to die, remember we said the 2 times that cats get sick are when the worms are migrating and when the worms die. Right. So those are the danger times. Those cats will all of a sudden present like they can't breathe. They'll be salivating. They'll be just in almost like an agony, like trying to get air in, and you rush them in, and a lot of people will think, oh, this may be feline asthma. But anytime it looks like feline asthma and they're not on heartworm prevention, you have to rule out heartworms as being a potential cause.
Right. That's a good segue into being with cats. Now, there are preventative for cats. The one I can think of is something called Revolution that's available to us to give to cats. But typically, I don't put my cats on a prevention. What's your thoughts on that? A lot of times it's difficult to convince people that they should be putting their cats on prevention.
Because of how catastrophic heartworm disease is in cats, I 100% recommend putting cats on heartworm prevention. 100%. It's so easy to do, and you're talking about potentially saving a life, because you cannot promise to get a cat through heartworm.
Or a dog.
Or correct. We have a better success rate with dogs, but cats, it's tough.
One question that occurred to me is that when these embolisms form, can they also hit the brain and cause strokes in the animals?
Excellent question. Typically, if the emboli form on the left side of the heart, they can get pushed out to the brain. These are typically forming on the right side and in the lungs, and so they just more block up blood flow through the lungs. So for instance, if you go on a very long flight, and especially international flights, they want people to stand up and do calisthenics and such, because they want to prevent the blood clots you get in your legs that can fly to your lungs and cause you to have trouble breathing when you get off the plane.
Excellent, excellent. I just want to make 2 more points. One, that a lot of this information is available through the American Heartworm Society.org, and it's called, I think it's heartwormsociety.org, that people can look at in their on their website. And then if anyone has any questions about this program, they can contact me at maplewoodah@comcast.net. That's my website or my email address. And we're happy to help you in any way we can.
Okay, thank you very much for watching, and I want to thank you, Dr. Rogers and Dr. Goodwin. This has been a very enlightening discussion, and we hope to continue talking about preventative care disease the next time we are on the air. Thank you.